Official figures show more than 400,000 have died because of coronavirus. What is the real number? How many people died because they couldn't get treatment for other illnesses? A BBC investigation has looked at 27 different countries and found the total number of deaths caused by the virus, directly and indirectly, is much higher than has been reported. This report by Sofia Betiza starts in Indonesia.
A father buries his youngest son. A mother distraught. 3-year-old Rafa did not have coronavirus, but his parents say he died because of it. He had leukemia. When his condition got worse, his parents raced to hospital.
It was around midnight. The hospital said he would need to be tested for COVID-19 before he could be admitted anywhere. Another hospital told us there wasn't a children's doctor on duty, and the quick COVID tests they had were only being used for pregnant women.
Rafa's parents drove him to 3 more hospitals that night, with no success. The next day, they eventually found a hospital that would accept him, but he died before doctors could see him.
I still believe that if my son was given prompt treatment, he would still be alive. But he was turned away and tossed from one hospital to another. I could do nothing.
Rafa is one of tens of thousands of people whose deaths are not officially counted as being caused by coronavirus, but are still victims of this pandemic. Since the outbreak of the virus, lots of countries are recording more deaths than usual. You can see a bump in the graph here. These are called excess deaths. Now, many of these have officially been linked to coronavirus, as you can see here in red. But that still leaves a huge number of lives lost, which are not accounted for in the COVID statistics. The Italian region of Lombardy saw more than double the number of deaths than expected. One of them was Luca's mother. Luciana had pancreatic cancer. When she tested positive for Covid-19, her chemotherapy was stopped immediately. But when she got better, her treatment was never resumed.
Quindi tu pensi che se lei avesse continuato con la chemio come doveva, probabilmente il suo adesso starebbe ancora con noi.
Io lo penso, ma lo penso.
Yes, I believe so, because her doctor said everything was under control, as the cancer hadn't spread to her liver.
Abbia accelerato.
My mom was optimistic. We made plans for the future, but the virus accelerated her death. She could have been with me for many more months, or even years.
In Brazil, a similar story of grief.
My mother was a warrior who fought for her children all her life.
Andrea says that after her mum had a stroke, the hospital discharged her too soon because they needed to free up beds for COVID patients. A few days after she came back home, her heart suddenly stopped beating.
My sister tried to beat her chest, but it didn't work. At the hospital, she would have been revived. She did not die from the disease, but she died because of the disease. And so many other people are dying in Brazil and in the world that they are not counting. It's scary. It's scary.
Isso é assustador.